What is the primary role of a home health aide, HHA? A. To diagnose illnesses. B. To provide basic care and support to clients in their homes. C. To prescribe medications. D. To perform surgery. Answer, B. HHAs assist with daily living activities, personal care, and home support, not medical diagnosis or treatment. Which of the following is a correct example of respecting client privacy? A. Sharing client details with neighbors. B. Closing the door before assisting with bathing. C. Talking loudly about the client in public places. D. Allowing anyone to enter the client's room. Answer, B. Respecting privacy means protecting the client's dignity and confidentiality during care. Before transferring a client from bed to wheelchair, the HHA should first A. Lock the wheelchair brakes. B. Remove the wheelchair cushion. C. Lower the bed to the floor. D. Ask the client to stand without help. Answer, A. Locking the brakes prevents accidents during transfers. A client begins choking while eating. What is the first action for the HHA? A. Call 911 immediately. B. Perform abdominal thrusts if the client cannot breathe. C. Give them water. D. Run to get another aide. Answer, B. If the client cannot speak or breathe, abdominal thrusts, Heimlich maneuver, should be performed. Which of the following is considered a normal pulse rate for an adult? A. 20 to 40 beats per minute. B. 40 to 60 beats per minute. C. 60 to 100 beats per minute. D. 120 to 150 beats per minute. Answer, C. The normal adult pulse rate is 60 to 100 bpm. When assisting a client with a walker, the HHA should A. Walk behind the client. B. Walk slightly to the side and support if needed. C. Hold the walker for the client. D. Pull the walker forward each step. Answer, B. Staying slightly to the side allows the aide to provide balanced support while ensuring independence. Proper hand hygiene requires washing hands for at least A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 2 minutes. Answer, C. At least 20 seconds of hand washing is recommended to prevent infection spread. A client refuses to take a bath. The HHA should A. Force them to bathe. B. Respect their choice and report it to the nurse. C. Argue until they agree. D. Leave them without further care. Answer, B. Respecting client rights means honoring choices and reporting refusals to the supervisor. Which food is most appropriate for a diabetic client? A. Chocolate cake. B. Whole grain toast. C. Soda. D. Candy bar. Answer, B. Whole grains provide complex carbohydrates and help manage blood sugar levels. The best way to prevent falls in a client's home is to A. Place rugs everywhere. B. Keep pathways clutter-free. C. Turn off all lights. D. Encourage rushing during walking. Answer, B. A clear, clutter-free pathway reduces fall risk. When taking a client's temperature orally, the thermometer should be placed A. Under the tongue. B. In the ear. C. On the forehead. D. Under the arm. Answer, A. Oral thermometers are positioned under the tongue for accuracy. If a client has difficulty hearing, the HHA should A. Shout loudly. B. Face the client and speak clearly. C. Turn away while speaking. D. Avoid talking to the client. Answer B. Facing the client and speaking clearly improves understanding without yelling. Which of these tasks is outside the HHA's scope of practice? A. Assisting with grooming. B. Measuring vital signs. C. Giving prescribed medications without nurse instruction. D. Helping with mobility. Answer C. HHAs do not administer medications unless permitted by state law under supervision. What should the HHA do if they notice signs of abuse on a client? A. Ignore it. B. Report immediately to the supervisor. C. Ask the abuser politely to stop. D. Wait until the next visit. Answer B. HHAs are mandated reporters and must notify supervisors immediately. Which position is safest for a client who is eating in bed? A. Flat on the back. B. Supine with legs raised. C. Sitting upright at 90 degrees. D. On the stomach. Answer C. Sitting upright reduces risk of aspiration. When documenting care, the HHA should A. Write only positive notes. B. Use facts, not personal opinions. C. Guess information if unsure. D. Leave blank spaces. Answer B. Documentation must be objective, accurate, and factual. Which of the following best demonstrates empathy? A. Ignoring client complaints. B. Saying, I understand this must be hard for you. C. Changing the subject quickly. D. Leaving the room silently. Answer B. Empathy is acknowledging and validating the client's feelings. What is the first step before providing care to any client? A. Wash hands. B. Put on gloves. C. Prepare supplies. D. Call the family. Answer A. Hand washing is the first step in infection control. A client with dementia begins wandering at night. The HHA should A. Lock all the doors without telling anyone. B. Gently redirect the client to a safe activity or back to bed. C. Yell to stop them. D. Restrain them immediately. Answer B. Redirection is the safest and most respectful approach. A client suddenly becomes unresponsive. The HHA should A. Call 911 immediately and begin CPR if trained. B. Wait for the nurse to arrive. C. Put them back in bed and watch. D. Ignore and continue with other tasks. Answer A. Emergency response requires activating EMS and starting CPR if qualified. When measuring a client's blood pressure, the cuff should be placed A. Around the ankle. B. On the upper arm, level with the heart. C. Around the wrist above the hand. D. On the thigh only. Answer B. Correct placement on the upper arm at heart level ensures accurate readings. Which of the following fluids is usually restricted for a client on a fluid-restricted diet? A. Coffee. B. Juice. C. Soup. D. All of the above. Answer D. Any liquid counts toward fluid intake and may be restricted. If a client complains of shortness of breath, the HHA should A. Place them flat on their back. B. Encourage them to sit upright. C. Offer a sugary snack. D. Leave them alone to rest. Answer B. Upright positioning helps ease breathing difficulties. When assisting a client with dentures, the HHA should A. Use hot water for cleaning. B. Store them in cool water when not in use. C. Place them on a napkin by the bed. D. Scrub them with bleach. Answer: B. Dentures must be stored in cool water to prevent drying or warping. Which is the safest way to identify a client before care? A. Ask their family who they are. B. Check the care plan and confirm name directly with the client. C. Assume based on room number. D. Use appearance only. Answer: B. Verification must be done with the client or official records, not assumptions. When handling soiled linens, the HHA should: A. Shake them to remove debris. B. Hug them close to their uniform. C. Roll them away from the body and place in a laundry bag. D. Drop them on the floor before bagging. Answer: C. Linens should be rolled away from the body to prevent contamination. Which is the first sign of a pressure ulcer? A. Open wound. B. Redness that does not fade. C. Blisters. D. Drainage from skin. Answer: B. Persistent redness indicates early-stage pressure injury. A client is fasting for a medical test. The HHA should: A. Offer small snacks. B. Provide only water if allowed. C. Encourage a big meal before testing. D. Ignore the restriction. Answer: B. Only water may be allowed during fasting. Follow care plan. Which of the following is an example of standard precautions? A. Wearing gloves when handling body fluids. B. Using the same gloves for all clients. C. Avoiding hand washing after glove removal. D. Reusing gowns. Answer: A. Standard precautions require gloves whenever in contact with body fluids. Which type of bath is given when the client can do most of the washing but needs some help? A. Complete bed bath. B. Partial bath. C. Shower only. D. Sponge bath. Answer: B. A partial bath is given when the client assists but requires help with some areas. A client with Parkinson's disease may need help with: A. Writing clearly. B. Steady movements during eating. C. Walking safely with support. D. All of the above. Answer: D. Parkinson's affects movement, writing, and daily activities. Which nutrient is most important for tissue healing? A. Protein. B. Fat. C. Sugar. D. Water only. Answer: A. Protein supports growth and repair of body tissues. When a client complains of pain, the HHA should: A. Report it to the nurse immediately. B. Ignore it if vital signs are normal. C. Give aspirin from home supplies. D. Distract the client without documenting. Answer: A. HHAs cannot administer pain medications but must report pain promptly. Which activity best supports independence for clients? A. Doing all tasks for them. B. Encouraging them to do as much as they can safely. C. Limiting their movement. D. Ignoring their choices. Answer: B. Encouraging self-care promotes dignity and independence. When assisting a client with eating, the HHA should: A. Feed them quickly to save time. B. Sit at eye level and allow adequate time. C. Stand over them. D. Choose food for them without asking. Answer: B. Sitting at eye level and allowing time respects dignity and safety. Which of these is a safe way to prevent infection spread at home? A. Reusing disposable gloves. B. Washing hands before and after care. C. Using the same towel for multiple clients. D. Avoiding cleaning supplies. Answer B. Hand hygiene is the most effective infection control practice. A client reports dizziness while standing. The HHA should first A. Support them to sit or lie down. B. Give them strong coffee. C. Ignore and continue care. D. Ask them to walk faster. Answer A. Preventing falls by sitting or lying down is the immediate response. What is the correct way to remove gloves? A. Pull off both gloves at once. B. Peel off one glove, hold it in the other, and remove the second glove without touching skin. C. Shake them off. D. Remove with teeth if hands are busy. Answer B. Gloves must be removed without touching contaminated surfaces. A client's care plan states assist with range of motion exercises. The HHA should A. Perform movements beyond the client's comfort. B. Move joints slowly within normal limits. C. Skip exercises if the client resists. D. Apply heavy weights during exercise. Answer B. ROM exercises should be done gently and within comfort range. When providing catheter care, the HHA should always A. Pull on the catheter to check tightness. B. Clean from the meatus outward. C. Use hot water for cleaning. D. Keep the drainage bag above bladder level. Answer B. Cleaning from the meatus outward reduces infection risk. Which action helps prevent aspiration during feeding? A. Feeding quickly. B. Keeping the client upright. C. Letting the client eat while lying flat. D. Offering large bites. Answer B. Upright position lowers aspiration risk. A client with heart failure is on a low-sodium diet. Which food should be avoided? A. Fresh apple. B. Unsalted rice. C. Canned soup. D. Steamed vegetables. Answer C. Processed foods like canned soup are high in sodium. When assisting a client with a cane, the HHA should remind them to hold the cane A. On the weaker side. B. On the stronger side. C. Behind the body. D. In both hands. Answer B. The cane should be held on the stronger side for balance. A client complains that their hearing aid isn't working. The HHA should first A. Replace the battery if trained. B. Throw it away. C. Ignore the complaint. D. Put it in water to clean. Answer A. Checking and replacing the battery is a simple first step. The best way to promote good communication with a confused client is to A. Use short, simple sentences. B. Speak quickly. C. Give multiple instructions at once. D. Avoid eye contact. Answer A. Clear, simple communication reduces confusion. Which of the following can reduce pressure ulcer risk? A. Repositioning the client regularly. B. Leaving them in the same spot all day. C. Placing objects under their back. D. Ignoring skin changes. Answer A. Regular repositioning prevents prolonged pressure on skin. The safest way to lift heavy objects is to A. Bend at the waist. B. Keep back straight and bend knees. C. Twist while lifting. D. Pull with arms only. Answer B. Proper body mechanics protect the aide from injury. A client's family member asks about their medical condition. The HHA should A. Share full details. B. Refer them to the nurse or supervisor. C. Guess an answer. D. Ignore them completely. Answer B. HHAs must not share confidential information, direct questions to the nurse. Which of these is considered a psychosocial need? A. Exercise. B. Love and belonging. C. Nutrition. D. Hygiene. Answer B. Psychosocial needs include emotional and social well-being, like love and belonging. A client begins to cry during care. The best response by the HHA is to A. Tell them to stop crying. B. Leave the room quickly. C. Offer comfort and listen. D. Ignore the behavior. Answer C. Providing emotional support and listening shows empathy and respect.